At birth, vaccines given at birth are BCG, hepatitis B, and oral polio vaccine. So the BCG protects against tuberculosis. Hepatitis B vaccine protects against hepatitis B virus infection, which causes liver disease. And then the oral polio vaccine protects against polio, which can cause paralysis. Then, after this, the next one is 6 weeks vaccine. Oral polio vaccine, pneumococcal conjugate vaccine, penta 1, rota vaccine 1, rotavirus vaccine 1, and injectable polio vaccine 1. Pneumococcal conjugate vaccine protects against pneumonia, meningitis, and ear infection. Pentavalent vaccine contains 5 vaccines: diphtheria, pertussis, tetanus toxoid, Haemophilus influenza type B, and hepatitis B vaccine. These protect against diphtheria, whooping cough, tetanus, hepatitis B virus, and other infections like meningitis. Penta is likely to cause fever because it is painful. Pentavalent vaccine. Okay, so fever is a common side effect of immunizations, especially pentavalent vaccine. All you need to do is to give paracetamol every 6 hours for the first 2 to 3 days. If the fever persists, please take the child to see a pediatrician. Take the child to the hospital. Now, this is Rota. Rota was a private vaccine, but currently since 2022, 12th December, I think, it was paid for, and now you can have it for free. You don't have to pay for rotavirus vaccine anymore. So rotavirus protects against diarrhea in children. Okay. Now, the next vaccine after 6 weeks is a 10 weeks vaccine, the oral polio vaccine 2, PCV pneumococcal conjugate vaccine 2, pentavalent vaccine 2, and rotavirus vaccine 2. When you see one, this represents this one presents 6 weeks, 2 10 weeks, and 3 14 weeks. So you should not skip anyone. You're taking the OPV, PCV, Penta, and rotavirus vaccine, which I just explained in the 6 weeks column. So now in the 14th week, you also be given oral polio vaccine, PCV, pneumococcal conjugate vaccine, pentavalent vaccine, rotavirus vaccine 3, IPV, injectable polio vaccine 2. Okay, so that's it. At 6 months, your child will be given vitamin A. Vitamin A is a supplement that boosts immunity against infectious diseases and protects against blindness. So it is not necessarily a vaccine, but a supplement. Okay, so now this is measles. Okay, this measles vaccine, this one, measles 1, fever, yellow fever 1, and meningitis are administered at 9 months. Okay, so measles vaccine protects against measles infection. Yellow fever vaccine protects against yellow fever infection, and meningitis as well protects against meningitis. Meningitis is also a brain infection. Now, there are other private vaccines like chickenpox, also called varicella, which protects against chickenpox, and another one called MMR. MMR means mumps, measles, and rubella, and it protects against measles, mumps, and rubella.